Hello and welcome to our webinar on mental health nursing and adult nursing at the University of West London. Today we have myself, Natalie Hyde from the recruitment team, Heleno Ferraz, lecturer in mental health nursing, and Luke Cox, lecturer in adult nursing, both of whom you'll hear from very soon. We also have members of the recruitment and admissions teams answering questions. Thank you for joining us today. There's a big group of you online, so we look forward to you to answering your questions. Today's webinar is geared towards undergraduate study at UWL. Some of you online will be holding offers to come and study with us in September, and others won't yet have applied or may be thinking about applying with us in future years. Either way, today's webinar will be relevant to you. Let's have a look at what we're going to cover in today's session. To start, we'll tell you a bit about the university and what makes us special. I will then pass you over to Heleno and Luke, who will guide us through our nursing courses. Finally, we'll be ready to take any questions you have, but do feel free to ask them as we go through too, and we'll aim to respond to each of you as quickly as possible. The University of West London is a vibrant, modern university with a reputation for high-quality education closely linked to employment. We aim to inspire our students to become innovative professionals ready to challenge accepted norms and boundaries in order to carve out exciting and rewarding careers. We have the best graduate employment rate in London, with 96% of students in full-time work or further study within 6 months of graduation, and they're earning the highest salaries from any modern London university. Everything we do is designed to equip you with both the academic knowledge and practical skills to succeed in your chosen career. That's why we are the Career University. The university itself is structured into 8 specialist schools, each of which has its own unique character and reputation and industry. In terms of our student body, we have around 11,000 students, roughly 15% of which are international students from all over the world. That may sound like a lot of students, but our typical lecture size is only around 28 students, though it varies and we do have larger lectures, and seminars are typically made up of around 18 students, workshops around 14 students. This enabled us to really focus on our students as individuals. And this approach seems to work, as we were recently voted as Best in London for Student Satisfaction, and we have the best students' union in London in the annual National Student Satisfaction Survey. The university has recently undergone a £100 million campus investment to ensure our students have access to state-of-the-art learning and social facilities. If you're not familiar with our location, our West London campuses in Ealing and Brentford are located in 2 of the most desirable places to live in the capital. Both towns combine a vibrant, cosmopolitan atmosphere with spacious parks and a relaxed cafe culture. The area is safe, it's beautiful, multicultural and close to both London Heathrow Airport and the centre of London, which you can reach in under 30 minutes by tube. I'm now going to hand over to my colleagues Heleno and Luke, who will tell you about nursing at UWL.
Hi, hello. Thanks, Natalie. I'm Heleno Ferraz, and I am one of the senior lecturers in the mental health nursing program. And I'm going to start the presentation by just starting to think about why would you like to become a nurse and why should you become a nurse. The first thing to say is that nursing gives you a real opportunity to make a difference to just 1 second. Right, okay. Gives you a real opportunity to make a difference to people's lives. You often are going to be working with people who are feeling really unwell, but also you're going to follow them up through the various different stages, and you're going to get them to a point where they feel well and they are ready to go home. And that in itself is very rewarding, especially when you see patients thanking you for the help you offered them. So this is really satisfying. The other thing to think about nursing is that we are the largest staff work in the NHS. So there's a huge number of nurses, and everywhere you go, within the health setting, you are likely to come across a nurse. For example, if you go to A&E, you'll be helped by a nurse. You can also help and work with patients at home with all ages and background. So this is really important to consider how big the nursing workforce is and how important a role we play. So here at the University of West London, we offer undergraduate courses in all 4 branches of nursing, and that is the adult branch, mental health, also children's branch, and learning disability. And we'll tell you about the adult branch and mental health nursing in more detail later on. So once you finish your undergraduate degree, you will then have opportunity to progress and develop and specialize in various areas of nursing. So nursing is that gives you a really good opportunity to expand your horizons and to also develop your career. So, how will you study? So, what does it mean? What's your education is going to be look like here at UWL? So, studying for a degree in nursing is very different from studying for any other degree, and that's because you're studying to become a professional. So there are 3 main themes for your learning here at UWL. One is going to be the classroom-based learning. This is where you have your lectures. So you come, you may have some group work, you have some formal teaching, and that's where we're going to give you some of the theoretical background to your chosen field of nursing. 50% of your time is going to be spent in practice, and that's because, as I said, you are learning to become a professional. So therefore you need to practice the skills of the profession. And finally, one of the very important aspects of the education here is the simulation-based center. So we have a very well equipped center where you will do some of the practical aspect of nursing before you can go on and actually work with patients. So things, for example, like injections, taking blood pressure, all of those skills that are very important you will be doing in a lab before you go on to practice and to work with real people. So this is a real bonus that you can have when you come to UWL. So what will you study? So I just want to give you an idea of some of the modules and some of the courses that you're going to be studying when you join the nursing course. So as I already mentioned, you have a series of modules. Our course is organized over 3 years. And for the first year, you're going to have some of the essential skills and some of the research that is really required and important for you to be able to do nursing. So for example, IT literacy. Most of our courses, you have to access it via online. So for example, we have Blackboard. So you need to be able to use that and to access, and it will give you all the skills that you require. So this is really the foundation year and is the introduction. So we'll offer you a lot of support during the first year. So when you move on to the second year, that's when you start doing your practice. So that's when you start going and doing some of your placements. And you are also going to start exploring and learning some of the very important science-based knowledge. So for example, you're going to be looking at altered physiology, some of the concepts of medicine management. So these are all very important skills and we'll take you through during year 2. Year 3, that is really your final year, and that's when you're being prepared to become an autonomous practitioner. So we're going to be talking to you and introducing you to evidence-based practice, reflective practice as well, which is a very important way of learning and developing your skills. and some of the other modules that are really important, for example, clinical decision making, leadership, management, team working, and research. So, I've given you a very sort of a broad overview over the courses, over the sort of a generic modules that you're going to be studying when you join UWL. What I wanted to do now is just to give you a very brief overview on the mental health nursing program. So it's quite important to understand that as a mental health nurse, your role is quite unique. You'll be promoting and supporting the recovery of your patients. And recovery is a very important concept that you'll get to learn during your course. It's something that you're going to have to be constantly thinking about and applying during your practice. It's very important that as a psychiatric nurse, or as a mental health nurse, you have really good personal skills, communication skills, because you're going to be spending a lot of time listening and supporting people through their very difficult stages in life. Therefore, it's very important that you are able to engage well, that you are able to respect people during this process, and that you show empathy, real empathy. And these are the things that you're going to be developing during the course. In addition to all of that, also you will have some real mental health theory that is related to practice of nursing. So just going through some of the topics that you might be covering during this 3 years course. As I already mentioned early on, so you're going to be looking at, in very detail, recovery and well-being. So what it means, recovery for our patient. And just to give you an example, recovery means it's a journey. So our patients experiencing mental health, they will never really get cured, but they will recover gradually. You will also be exploring some mental health nursing skills that's very specific to the profession. As I said, engaging, communication, empathy, some of the counseling skills. Physical health, care for mental health, again, is another important topic that you'll be exploring. Some of the psychological therapies, including cognitive approach, family working. You're also going to be looking at dementia and others. I just want to finish by looking at some of the possible clinical settings that you might be working once you qualify as a psychiatric or mental health nurse. So you could either be working in a hospital, and that would mean a psychiatric ward, for example, or an outpatient unit. You could also be employed as a specialist nurse in an eating disorder unit. So if you are working in the community, you could be at a GP surgery, a prison, for example, community healthcare center, residential center, and then there is a number of other areas that you could explore. Also, you could be working at patients' own homes. So this is very much the end of the presentation for me, and I'm now going to hand you over to Luke, who will talk to you a bit more about adult nursing.
Cool, thank you, Heleno. I'll just get my bit of the presentation up here. Okay, so we want to talk a bit about adult nursing specifically. And when I was thinking about this, I was thinking that, I don't know, adult nursing sometimes gets a bit of a bad press, and hospitals are seen like tough places to work. And I wondered what it is about nursing in particular, and adult nursing in particular, that makes people want to stay in the job and enjoy it. And I was thinking in terms of my clinical experience and my career, you find how the kind of how high profile and extensive the different nursing roles just in a hospital are. management is often a nursing responsibility. Acute care teams, critical care response teams are nurse-led. And you find that nurses are taking over a lot of the roles that are traditionally associated with medicine. So there are great opportunities to, say, become prescribers, to become nurse consultants, and to specialise in a lot of areas. So this kind of fits in with this idea of there being this enormous diversity over a great range of settings where you could work once you're qualified. And great opportunities to become specialised once you're qualified as well. So I worked in A&E for my nursing career and found that to be an incredible environment. That it's very much nurse-led. The opportunities for leadership and exploring resilience in your personality are second to none. This applies to nursing generally, but there's something about looking after people in physical ill health that is it's unique. It's a very privileged position, and that's something that is shared in common across all the different nursing roles that you could experience. You nurse people through ill health. You help them in their recovery. You promote health in people who are well, and you care for people in death. It's not just about the kind of medical cycle, as it were. There's something a lot more of a life picture and about holism about being a nurse, and it's privileged and it's unique. Nobody else gets to experience that. So I think that's why people enjoy nursing and why people stay in nursing and have really exciting careers. So we talked a bit about with Heleno about what we might study in terms of structure, and it's very similar in the way the course is structured for adult nurses as for mental health nurses. In the way I see it, there are some particular differences. So both will teach a mix of knowledge, skills and abilities, but I think within adult nursing there's a very practical emphasis on the link between some specific clinical skills, those knowledge and theories behind them, and then how you might manage yourself in practice in terms of sort of recognising stress and your limitations. We do have these courses that develop theoretical knowledge around lifespan development. You get excellent tuition on anatomy and physiology, particularly altered anatomy and physiology, and a lot of support in developing your management of medicine skills. There are a wide range of placement areas over several different NHS trusts, which include many different hospitals and community settings. As Heleno mentioned earlier, 50% of the time you spend is in practice. So there's this really strong link between having the skills developed in your classroom setting and then trying them out in practice and developing them there. And what I notice is that nurses in their final years, before they qualify, are really taking on this role of becoming members of a very dynamic team, making some very key decisions about patients' care. And this is what we would like our nurses to become when they are qualified. Sort of the innovators, the people who bring the NHS forward, the people who are driven by their values. We also have an emphasis on technology-based learning here, and particularly within simulation. So Heleno mentioned the simulation centres. We have two, one at Reading and one at the campus in Brentford. And I'll show you a bit more about those in a minute, but it is a key part of the nursing courses here that you are able to practice skills in simulation, and that kind of helps the theory become real. Now, I wouldn't pretend that nursing is a vocation that's not without stress. You do require a lot of support as you go through the years of your placement, and as much as anything, that's because of the emotional content involved in your work. with that privilege that I talked about, there comes a great deal of responsibility, and there are lots of questions about how you will manage that within yourself. I feel this university supports its students amazingly well. So as you go through your university career, you'll find you have a personal tutor. So I'm the personal tutor to a group of 21 students. That's somebody who's kind of on call for you, who can help you with how you're dealing with assignments, how you're dealing with any personal issues that you're going through. Each module, each academic module, also has a leader who's responsible for the content and will support you. And your cohort, which may be sort of somewhere between 80 and or 150 students of student nurses going through this experience together, will have a course leader who has this kind of helicopter view of the different events going on. And of course backed up by an excellent administrative team. And then there are also very dedicated services for students and our excellent Students' Union. When you go into practice, the university doesn't leave you behind. The mentors in our placement areas are trained by the university and given regular updates. The clinical teams in placements often have practice educators and practice development nurses who will work with student nurses to help orientate them towards to develop their skills in practice. And then we have a link lecturer team that works at the university as well. So their job will be to talk to the placements themselves to find out if there are any problems going on in the placements. We'll do educational audits, but mainly to support students while they're in practice. So if you are in a hospital ward on a placement and there are things you are finding hard or things that you find are going very well, you can talk to the link lecturer team and they will be able to discuss those issues with you. We often make visits to the hospitals in order to meet students. There's also the placements team who work with the university coordinating placements, and my experience of them is that they're very, very well organised and very helpful, often catering quite specifically to people's requests and needs. So we can't accommodate every single request for where you go on placement, but there does seem to be a very fair allocation that is done on an individual basis. So I wanted to talk a bit more about simulation. This is sort of an area that's a bit of a passion of mine. We use technology-based learning quite extensively. It is a very modern university. There are lots of online platforms and e-learning platforms that we use. PebblePad, which is mentioned here, is a way of maintaining a portfolio as you go through your 3 years of nursing education. And that's something you can keep with you once you qualify. It allows you to provide evidence of skills training, etc. There's also a system called Blackboard, which basically coordinates people's timetables, their kind of references, and I think you could probably go the 3 years without needing to print out a timetable for anything because it is stored so effectively on this system. And we have these 2 simulation centres, so one in Reading at Fountain House and one at Brentford at Paragon House. Now, simulation is, in my mind, an excellent way to practice clinical skills away from the clinical setting. So one way of looking at it is it's the opportunity to make mistakes. Another is to think that you can't actually practice on real people. And we can use simulation to make sure that skills that are going to be used in practice are done safely. There's another aspect to it as well, which is that often when clinical events happen, you don't get the chance to talk about them effectively. You don't get the chance to really take them apart and see what it is that that was important about those experiences. So we will run high fidelity scenarios that will be debriefed. We may find that stress is an issue, or communication. And we can discuss those and see if there's any learning we can take out from them. We use a wide variety of ways of doing this. So we have these very realistic robots called human patient simulators. We'll also bring actors into the learning environment. We can use noises, props, and the settings can be made to be anything. This isn't something peculiar to adult nursing. Mental health nursing uses simulation a great deal. We use actors to simulate somebody who has a mental health problem. And we can discuss how communication can improve those situations. We also have a link to the London College of Music, which is part of UWL. They will often have actors from their performing arts areas who would like to come in and play the role of patients. So it's a very effective collaboration. I'll show you some pictures now of the simulation environment. That these are pictures taken at the Brentford site. So here, this is a student nurse who is visiting Mike, one of our mannequins, in their home environment. We have other props like called quick screens that will make it seem very much like it's walking into somebody's house. Here's a student nurse doing the blood pressure on somebody in a ward environment. So the mannequins are very realistic. They could be programmed to exhibit certain clinical signs. That you can take blood pressures on them. They will talk and respond to you. They are very effective for not only these clinical skills, but seeing the whole process, so promoting dignity, seeing how your professionalism works. And here is a student nurse taking the pulse of an actress who has come in to assist with the work in the university. So the advantage of having actors and actresses come in is that they can communicate in a much more effective way, and we can explore how that works. So just to kind of sum up a little bit, it's just to talk about the idea that the education that we provide, the nursing education that we provide, does work. We have, amongst the University of West London colleges, we have one of the highest rates of employability after graduation. So the most recent figure is that 100% of mental health nurses will find jobs as soon as they qualify, and 99% of adult nurses are offered jobs too. This doesn't necessarily have to be in the NHS, although that does account for the majority of those posts, but nurses will go on to work in a wide variety of settings, which includes the independent sector. And I know nurses who work abroad, who have joined charities, NGOs, who work on cruise ships, who work in the Arctic Circle. It's not confined to working in a hospital in the NHS. So there are such a wide variety of opportunities that present. So just to summarise what Heleno and I have been through, so we're looking at modular progressive courses that build you up year on year. So you're not expected to be an autonomous practitioner after year one of your course, but by the third year you have these competencies and confidence, and you have the educational and theoretical basis to back it up. We have really well varied and well supported placements, and we do have a strong link to technology and technology-based learning, particularly within simulation. These are aspects of modern education that we believe in. And then just to say, nursing can take you places. As part of the community, it's a very valued role. And it has many, many different aspects. So if you became a nurse through UWL, you would have excellent career prospects because you would be very, very employable, not just because the world needs nurses, but because you would be a good one. So thanks for listening to Heleno and I, and that concludes our presentation.
Thanks for all the questions we've had so far. We've now got time for any further questions you may have. Remember to let us know if you're an international student so we can respond appropriately to you. While we're answering questions, take a look at our next events and webinars. So we have a campus day on the open day, on Wednesday the 21st of June. To book onto this, you just need to go to www.uwl.ac.uk/open, and this gives you an opportunity to speak to lecturers, to see our accommodation, and also see our simulation centre.
So there's a question from one of the participants wanting to know a bit more about mental health nursing. So, so as I already mentioned, so mental health nursing it's a 3-year course, and it consists of 50% of practice, 50% theory. But if you are interested in a postgrad diploma, which is also follows the same sort of format, this is a 2-year course. So anyone who has a first degree, and you have to have a either a 2-1 or 2-2 classification, you would then be eligible to apply for the 2-year postgrad diploma in mental health nursing. So this is a condensed course, so you're obviously doing 3 years in 2, but it will give you the same registration that you would get during the 3 years. I hope that answers your question. So if you have any specific question in relation to the mental health PGDIP, I can try and answer as well. There are some questions. This may be a generic question around deadline for September 17 courses. So you can really apply up until close to the starting date of the course. But the sooner you apply, the better. If you're particularly interested studying here with us, then obviously you need to make sure that you secure a place, because otherwise you could end up with no place available for you. So there's another question asking about the trusts that we have placements with. So we have 2 main trusts that we have placements. They're both of them here on West London, and one of them is the West London Mental Health Trust, which is one of the largest trusts in London, and also we have placements with the Central and Northwest London Trust.
Shall I answer this question about nursing apprenticeships?
Yeah, okay.
Yeah, so there's nursing associates are a new role within the NHS. They're going to be regulated by the Nursing and Midwifery Council, and we will be running places for nursing associates here. These tend to be seconded by trusts, so if you're working in a trust already in a healthcare setting, perhaps as a nursing assistant or as a healthcare assistant, you should talk to the development team there to see whether they are likely to second you. It's certainly something worth being interested in, though. Does that answer your question? Please write if not.
So there's another question asking about the interview process. So basically it's a full day. Usually what happens the first part in the morning, you have numeracy and literacy test, and then following that, if you pass those two tests, then you will be taking part in a group activity, and then finally a face-to-face interview. And that's really an opportunity for us to get to know you and for you to get to know us. So during that interview, we ask you some very basic questions about why you're interested in doing nursing. We may ask you to give some examples of the work you've been doing that helps towards your nursing. And also you have opportunity to ask us any questions that you may have.
So there's a question about bursaries here. So although there isn't a bursary, there are some things that help you through the course. So one of the things there is a book bundle. I think it's worth something like £100 that's given to all students on starting. So they give you the key texts that help you through the course. So that's one of the things that UWL has been able to negotiate on your behalf.
In regards to additional funding, we've also got, there are various different funding available through the Students' Loan Company, including Disabled Students Allowance, which can cover dyslexia and autism as well as other physical disabilities. There's also a Disability Living Allowance, there's a childcare grant, an Adult Independence Grant if you are a carer for an adult, and there's also a Parents' Learning Allowance as well. So there are other funding available, different types of funding available to you as well.
And just to say on the funding issue is that for the PGDIP, you still have funding, government funding. So for this year, you still get funding from the government. You won't have to pay for your fees. And what we know is that it's just for this year, so we don't know what's going to happen next year. So there's another question about asking around fees for mental health nursing. Yes, as we've been saying, so there is no bursaries anymore from September 17, except for postgrad diploma in nursing.
So I could answer this timetable for an adult nurse, so Monday to Friday. So I could tell you about what my cohort are doing next week. Obviously it'll be different in placement because you have the rota is determined by the placement itself. But in university, so on Monday, my students will be coming in and having a session on essential skills in kind of academic research between 9 and 1 o'clock. They'll be studying independently on Tuesday and Wednesday. They have a update session on basic life support on Thursday, a session on safeguarding that day as well. And on Friday we're doing part of our fundamentals of nursing practice, which is going to run from 9 in the morning till 1 o'clock. In doing that we're going to learn a bit about diversity. The rest of the time is independent study. So that would be a typical week. The emphasis would be on learning independently.
Yes, so there's another question around tuition fees for the 2-year course. Yes, I can confirm that. If you are joining the course this year, September, you will not have to pay for the course. So you're still entitled to government funding for that course.
If there are no more questions, we'll close the webinar now. Thanks for joining us today, and if you'd like to find out more about studying with us, visit www.uwl.ac.uk. We have just had one last question come through. We'll answer that one and then we'll close the webinar. Thank you very much for joining us today.
Yes, so there's another final question here asking for some further advice on course preparation. So if you're thinking in terms of initially for the interviews, so obviously you need to make sure that you have some examples of what you've been doing that helps you in relation to your interest of mental health nursing. Also thinking about why you are interested in nursing per se. With regards to the course, obviously mental health is a very interesting course. It requires commitment, but we will provide you all the support you need to complete the course successfully. You will be given reading lists, you'll be giving personal tutor support, and so we will give you sort of all the advice and support you need throughout the course so you can complete it successfully.
Again, thank you very much for joining us today. Please do come along to our open day on Wednesday the 21st of June, and if you have any other queries, please just visit our website www.uwl.ac.uk, where you should be able to find answers to any of your queries. Have a good evening and thank you very much.